Perfect. Awesome. Thank you so much. I know we chatted last week. Basically, I just for folks who are kind of maybe they weren't paying attention last week, right? They're enjoying the holiday, they're traveling, and they're like, okay, I'm going to go back to, my kids are going back to school. I'm going back to work. I'm going to take a test. It's normally really easy to book. And all of a sudden, they're finding no appointments available. They're finding no antigen tests available over the counter or online. And they're finding all of these in-person sites have wait times an hour. I'm looking at a line right now as I'm sitting here in my car at a local community center. First of all, these people were wondering why is it so hard to get a test right now?
I wish I knew the answer to why it is so difficult as we're about to start our third year of the pandemic for us to have widespread testing. And I think, unfortunately, in our battle against COVID-19, we've thought about prevention, we've thought about treatment, and we've thought about testing. Those are the three main battles that we're fighting. We have made tremendous progress on prevention with the vaccines. We've made really good progress on treatment with the antivirals and the monoclonal antibodies. But we're still lagging when it comes to testing. And I really think we need to step up our efforts to provide more widespread testing.
Yeah, and as you certainly know, it is a bunch of puzzle pieces that come together. It's community, community centers. It's the federal government maybe passing mandates to up production. It's the companies that make these. It's top to bottom. What are some practical things that you think could be done, could be changed in the next 2, 3, 6 months so we can see more testing availability?
I think it's really a looking at the supply and the demand. That's the equation that we want to balance out. And up until now, I don't think the demand has been nearly as high as it is going to be right after the holidays when everybody wants to test. And with the explosion of cases that we have seen with Omicron, and I think that's really driving a huge demand as well, because so many people are getting sick. We all now know somebody who has COVID or had COVID in the recent past. So I think in the next few months looking forward, we're going to need to funnel some resources into the manufacture, the supply, and the distribution of these tests. We also, I think, need to work with private insurance companies and private payers to make sure that people realize they don't just have to go to the government testing sites. They can go to a clinic that offers testing and have the clinic provide that testing free of charge, having the insurance company offset those costs. So I think those are the types of regulatory changes that need to happen. More testing sites, more manufacturer, supply, and distribution, and more accessibility by making it cost-free and easy for everyone to get, even if they have insurance or if they don't.
Yeah, I guess, my last big question is for people who are like trying desperately to find a test soon. What advice would you have for people to go ahead and do that?
I would say cast a wide net in terms of looking outside of your immediate geographical area, because there are a lot of sites in smaller areas here in Colorado. For example, some of the suburbs have sites that the main city doesn't. So make sure you try to look at many different departments of public health, not just in your immediate community, but potentially even farther out. The other resource that I think is really helpful is to call your primary care doctor, because they may have a sense of what is available on the local level, which sites, which facilities may have operational hours that are longer. Of course, holidays always pose a problem. So if you have a holiday weekend coming up, like Martin Luther King or President's Day or whatever, make sure you plan ahead of time, especially if you're going to travel, to make sure that you have supply of testing. And then finally, as President Biden has said, we are going to hopefully have more at-home tests available. So really talk to your county or state's public health department to try to figure out if you can sign up for an at-home testing program. That's what I've done. And it's been a savior, because I really haven't been able to buy those rapid tests, but I was able to get some through the Colorado Department of Public Health.
Oh, that's great. Is it, is it fair for me to say, is it accurate to say that there is a nationwide shortage of the antigen rapid tests?
There is a nationwide shortage of all types of tests. The antigen test, of course, being the most popular, but other tests as well, the PCR test, which we rely on because of its high sensitivity. Now, the CDC may also add testing as a return to work requirement. They're currently looking over those guidelines and take that 5 days and add testing as well. So if that happens, your employer may be another resource for you to turn to and see if they can help provide you a test to come back to work.
That's a great point. Thank you. Is there anything else that you think folks should know about when it comes to testing right now?
Do you want to mention just a real quick about the rapid tests with Omicron?
Yes, that'd be great. Thank you.
So, now we're really seeing two variants out there. We're seeing Delta and we're seeing Omicron. And Delta performs pretty well in terms of being detected on the rapid tests as well as the PCR. But what we've learned is that with Omicron, the rapid tests may be falsely negative. We've also learned that in vaccinated individuals, the rapid tests may end up being falsely negative because you're more likely to actually have symptoms before you have a high enough viral load, because just a little bit of virus can tickle your immune system to sort of wake up. So you might get a false negative early on in the course of the illness. So I would encourage you not just to do one single test, especially if you're doing a rapid test, but be sure to do serial testing, meaning do one test and another one a couple of days later, or do one test as a rapid and then follow that with a PCR test.
That's really great advice. I really appreciate your insight and your time. Thank you so much, Dr. Kohli.
My pleasure. I'm so sorry for being late.
Oh, no need to apologize ever. I appreciate all your time and insight. Thank you.
Okay. Have a good day. Take
You
care.
too.
Stay
Bye-bye.
safe.
Thank
Bye.
you.